Welcome to Impact Voices, a podcast on the people, the science, and the network that drives HIV prevention research in Africa. Impact Voices walks you through the journey to accelerate the development of vaccines and new technologies to combat AIDS epidemic. In this episode, we feature voices from UVRI Ayavi, HIV vaccine program in Entebbe, Uganda, Dr. Brenda Okech, the director, Dr. Annette Namvuya, the clinical trials manager, and Dr. Ali Setala, who heads the community studies department. This discussion is moderated by Matthias Wambuzi, the community engagement officer at UVRI Ayavi HIV vaccine program. Listen in.
We'll be having a conversation reflecting on the journey the program has had, making a contribution towards the global HIV prevention agenda, more specifically on the HIV vaccine research. Dr. Brenda, when we talk of 20 years of UVRI Ayavi HIV vaccine program, what can you say about the program's contribution towards the global health research agenda? Over to you.
Thank you for that exciting question. As a program, we've been in existence since 2001, and this program was established as a partnership between Ayavi International AIDS Vaccine in New York and the government of Uganda through the Ministry of Health. And it has been over 20 years of exciting work in the fight against HIV. And our dream is indeed a world that is without HIV. As a program, we've carried out over 9 trials in different aspects of HIV vaccines. We've started with the early phases, the first in human studies, phase 1. We've also had the opportunity to participate in phase 2 trials. And at the moment, as we speak, we are actually participating in 2 phase 3 studies. These are not of vaccines, but they are of HIV prevention injections. This is also very exciting because it's another tool to prevent HIV. So the 2 PrEP studies that we are working on are HPTN 084, and this is a study of cabotegravir, still to prevent HIV. And very exciting about this one is that it has been licensed and it's going to be given to people out there to prevent HIV. And this has been our dream. Yes, the earlier studies have not resulted in an HIV vaccine yet, but a lot has been learned from the work. And it's very important for all of us now that we are working on a study that is actually yielding a product that is going to be used out there. We are also participating in other related trials. At the moment, we also have 2 COVID-19 vaccine studies, and they are phase 3. So we are very excited to be able to contribute to HIV prevention, but also to COVID prevention and a healthy nation. So that has been a contribution, continually advocating the importance of a vaccine, because for a disease to be eradicated, vaccines are very important. We all know the story of smallpox, and so we believe that an HIV vaccine will be able to take us to that final mile. As we speak now, we have, as a country, about 54,000 new infections. Yes, we have all these tools, but as a program, we would love to see this brought down to 0. And we continue to advocate for the importance of an HIV vaccine. So that's been our contribution. Of course, not on our own, with different partners. As I mentioned, even our formation involved 2 different organizations, one in New York, one in Uganda. And over the years, partnerships have continued to be important. Yes, thank you.
Well, thank you very much, Dr. Brenda. Over to Dr. Ali. Dr. Ali, Dr. Brenda has greatly talked about our role in the HIV vaccine research. Why is it important for us as a program to work towards an HIV vaccine?
Yeah, thank you very much for that question. It's quite important to work towards an HIV vaccine as a program. We know that as a program, picking up from Dr. Brenda's conversation, we've greatly contributed towards characterization of some of the most at-risk populations in Uganda, and those are the fishing communities. We believe that these fishing communities are a potential population for an eventual HIV vaccine, and as a program, working towards an eventual HIV vaccine will help us add on to the existing HIV prevention options on top of the already existing prevention options like the injectable products, PrEP products. I think an HIV vaccine will go a long way towards reducing HIV in these most at-risk populations. Also, as a program, we will be able to build on to already the capacity that we have for HIV prevention research if we work towards an eventual HIV prevention vaccine.
Yes, thank you very much, Dr. Ali. Dr. Annette, I can see as if you need to make some input on the topic.
Well, thank you very much, Matthias. I can add that it's very important that as a program we participate in this research that will eventually bring the HIV vaccine, because we need, first of all, to contribute to the data that is going to be out there. We will not be happy as a nation for us to know that there is a vaccine and we never had any contribution to make. So it's important that we participate in this research. It also gives us an advantage to empower or to employ citizens of the country. When we conduct research, we know that there are different people that get employed to work in different positions. So in a way, it's beneficial.
When you talk of the discovery of an HIV vaccine, how will an HIV vaccine empower women?
So we know that there are very many options out there for preventing HIV, and I could mention a few. There is using condoms, and most of the prevention options are for men or are directed towards the men. When we get an HIV vaccine, it will be good for the women because they will not have to ask for permission from the men to be able to use the vaccine. Their options to choose from will be increased. So it's very important that we get all the various options that can be got that will help to prevent the HIV epidemic, especially among the women that are really most infected and affected.
Wow, thank you. Dr. Brenda, do you have anything to add on the role of women in science?
Yes, thank you so much for that. Women indeed bring another level of ideas and diversity onto the table as scientists, yes, but also as leaders. So it's very important to involve them. And like Dr. Annette already mentioned, of the 54,000 new infections, over 31,000 of them are in women. So women are greatly affected by HIV. So it's very important that women also get involved in finding the solution to this HIV. And like we had mentioned, vaccines have been known to be very important in completely eradicating diseases. Women are usually busy with their families, with their work, and an HIV vaccine, unlike the drug or the injection that they need to come for at the moment every 2 months, would give the women time to do their daily chores and at the same time look after their families. And like Dr. Annette mentioned, it's a discrete option for them. So it would be very exciting and would truly help us to put an end to HIV.
Wow, thank you very much. Dr. Brenda, once again, when we talk of the 20 years having been successful, we cannot leave partnerships, collaborations, and networks. We count the success around the three. What can you say has been the role of collaborations, partnerships, networks in our work? What do you have to say?
Thank you so much for highlighting the importance of partnerships. Through IAVI, we are again looking at a very exciting opportunity to carry out a study in adolescent girls and young women, a study that is called MAGI, where we are going to look at how to recruit and retain these young women 15 years and older in studies, because they are the ones who are most affected by HIV. And if a new product comes, they will be the best candidates for this vaccine. And so it is very crucial that we learn what are their preferences. How can we keep them coming for this new product when it is discovered? And through IAVI as well, we are now involved in a study of broadly neutralizing antibodies. These are antibodies that have been shown to neutralize or kill a wide range of HIV viruses. It has already been mentioned the challenge with HIV is that it continues to mutate. But these broadly neutralizing antibodies are manufactured and they are able to neutralize a wide range of viruses. So we are very excited that through partnership, we have been part of a study that is looking at the safety of this product in our population. And for this, we recruited 21 participants, and so far everything is going well. IAVI is as well working on germline technology with partners in South Africa, ORAM, and this is very exciting as well, because once these products come out, they will be used in these participants that I'm talking about. And as well as a program, we are part of ORAM. It's one of the centers sponsored by IAVI, but as well, we are part of them. They are leading a CTU, or a clinical trials unit, of which we are a member. So it has been very crucial for us to work with other organizations. As I speak also, we have a new partnership with University of Manitoba. They are going to help us to study the immunity in the mucosa of these young women that we are going to recruit, to see is there something that maybe makes them more susceptible to HIV than the general population. And some of this work we would not have been able to do on our own. But because of such partnerships, we are able to engage and be involved in the newest technologies that are there to fight against HIV and work for new products. So partnerships are very key. Even here within the UVRI where we are located, we collaborate with Uganda Virus Research Institute. We collaborate with the MRC, Medical Research Council. So partnerships are very key. We cannot have as much impact on our own as we do when we collaborate with others that have other strengths that we do not have. We are very privileged that we have a strength engaging with the fishing communities. We have a strength having done different kinds of phases of clinical studies. And then now we partner with others who are stronger in basic research, who are stronger in other disease areas, so that together we can really have great impact for the health of our nation, but also the world.
Wow.
Maybe just to add, partnerships are very important. In this world of applying for grants, when you apply for a grant, when you have a partner, chances of you getting your grant approved are higher. So it's very important to have the collaborations going.
Wow, thank you. Dr. Brenda and Annette have greatly talked about the north to south collaborations, networks, and partnerships. I wonder whether such partnerships, collaborations, and networks are necessary at the grassroots level. Here with me is Dr. Ali, the Community Studies Department. What is your take?
Partnerships with the local entities are quite important. We know that we cannot work with communities for recruitment of research participants and also uptake of some of the research products that we eventually end up in our research. So partnering with local governments, like partnerships with the Mukono District Local Government, the Wakiso District Local Government, and Kalangala Island District Local Government. Those partnerships are very important for us as a research institution to access these communities without any hurdles, and also the communities to easily uptake our services. For example, these district local governments have a health structure, they have health facilities that can help some of our research participants access services that we as a research organization cannot provide. For example, if some of the participants are found to be pregnant, they can easily access antenatal care services through the government health facilities, having partnered with the district local governments. And also these partnerships help us improve access to some of the services that are lacking in the research communities that we are working within. For example, in the fishing communities where we are working, there is limited access to sanitation services. And through these partnerships, we've managed to reach out to these communities in terms of improving access to pit latrines and also safe water. So partnerships are very important in us achieving our research agenda. We also know partnering with Mildmay, TASO, these organizations help us improve access to HIV care services. Once our participants are found to be HIV infected, we refer them to these partners so that they can access HIV treatment services. And those that have failed to participate in our research, they are negative but still high risk, we refer them for PrEP services through partnering with these organizations.
Wow, thank you very much. We continue to learn from you in this very important conversation. Dr. Ali, once again, there has been fundamental advances in the field of vaccine research. Can you say we have adopted or aligned to some of these advances? What is your take?
Yeah, thank you for that wonderful question. Over the 20 years of our existence, I can say that we've adapted to advances in the field of HIV vaccine research. We started with early phase clinical trials, mainly T-cell based trials, and we are moving into the current advances in line with other partners. For example, we are participating in research based on broadly neutralizing antibodies. So I believe that we are really advancing in terms of being part of the fundamental advances in the field of HIV vaccine research.
Yes. Any other additions from Dr. Annette?
Okay. I could also add that we participated in one study that used electroporation. This is a method where we needed to administer the vaccine through a machine that was giving the vaccine subcutaneously. And I'm hoping that this was an advance, and we've transitioned. When we started off with with products that were just giving intravenously, then we moved on to products that were giving subcutaneously using this electroporation machine. According to me, that's an advance.
Wow.
Then we started off with phase 1, phase 2 trials, prime boost regimens. Now we are moving on to phase 3. We are currently conducting phase 3 trials, like Dr. Brenda mentioned. We've advanced.
Great, great. Dr. Annette, back to you once again. You've been a strong champion on the capacity strengthening for scientific research. You are a distinguished lady. who has been part of these processes. What is the significance of developing scientific research capacity on the African continent?
Thank you very much, Matthias, for this question. The significance of developing African scientists is that we get to develop scientists from Africa that can lead research. In fact, I'm happy to mention that I am one of these scientists that have been developed. And this is capacity strengthening that has been made possible through IAVI with funding from USAID, and for this I'm very grateful. I know there are other scientists out there that have benefited from this kind of support, and I can say that it is very important that we get to develop African scientists, because then they will become the drivers of research. We have, for many years, had scientists from the north leading the research concepts out there. It would be very good if we have Africans now in the driver's seat.
Wow.
With regards to research.
Wow. Wow, wow. Dr. Ali, what is it to have an African scientist in the driver's seat towards an HIV vaccine agenda?
Yeah, thank you, Matthias. Just to add on to Dr. Aneti's submission, we know that as we are dealing with HIV vaccine research, most of the HIV-affected communities are within the African continent. And it is very important that actually we build local capacity, and that those are the African scientists, so that we can have meaningful collaborative partnerships that can actually drive the HIV vaccine development field further to impact on the communities that are really affected.
Yes, as we wind up, as we conclude, this one goes to all of you. We work extensively with the communities in our line of work. What is the place of community-rooted science in this regard?
When it comes to especially problems like HIV, where we know behavior is very important, and even COVID-19, where we had vaccines, but at some point people were even hesitant to take on those vaccines. So it's completely important that communities are involved from the very beginning, so that they can highlight what their needs are, and also for them to understand what the researchers are doing. And I believe the fact that Africans are also now being involved in the COVID-19 vaccine research, we will have data from Africans. That's also important. So that is very crucial, that we continually engage with communities. And here I really want to highlight the importance that the program has put in empowering communities, engaging community advisory boards of different ages, so that we can understand the community, and also the community can understand the research that is going on. Otherwise, we can have those products and nobody's taking them up. So I believe the community is part and parcel, because they are the ones that these products are aimed at, and we cannot do it on our own as researchers.
Wow. In a minute, over to Dr. Ali. What is your take? What is the place of community-rooted science?
Thank you, Matthias. Community-rooted science is very important in our research, because we know that these communities are the end users of the products that we are researching on. So, first of all, the design of our research activities is very much informed by the community-driven research. In that, if you have a product that may, let's say, an injectable product, you may find that maybe if the communities are not taking up the injection very well, information from community-driven research will inform you on how best you can adapt the design of your research activities to suit what the communities want.
Thank you. Over to Dr. Annette in a minute.
Thank you, Matthias. As Dr. Ali alluded to, We don't do this research for us, the scientists. We do the research for the community. When the community takes part in the research, they will own the research. So it's very important that we go out there to the communities and tell them what we do, get to hear what their ideas are so that we get to do what is exactly going to interest them.
Any closing sentiment from you, Dr. Annette?
I want to close by thanking you very much, first of all, for giving us the opportunity to talk about the work we do as a program. I want to thank IAVI for supporting us, for doing the work that we do, for conducting the many clinical trials that we have conducted, and also for empowering us as Ugandans. Without IAVI, probably I wouldn't be here, Dr. Brenda wouldn't be here, Dr. Ali wouldn't be here. We are very grateful to IAVI, and I know at some point we are going to get the HIV vaccine. Thank you very much.
Thank you. Dr. Ali?
Thank you very much. It has been a long journey, 20 years on, and I thank the participants that have made us get through this. We are very hopeful that we are going to be eventually getting a preventive HIV vaccine that will reduce HIV in our communities. Thank you very much.
Mine is just an excitement that we have come this far, 20 years on. We are looking at new technologies. We are looking at broadly neutralizing antibodies.
This has been an exciting panel, having such a wonderful conversation with the great scientists at the program. And for the audience, we are grateful for your time.
Thank you for listening to this episode of Impact Voices. We hope you enjoyed it and found it enlightening. Stay tuned for more episodes of the Impact Voices as we explore the vaccine research milestones together. Feel free to share this podcast with your networks and to follow our story on iavi.org/our-work/advance. This podcast is made possible by the support of the American people through the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, through United States Agency for International Development, USAID. The contents of this podcast are the sole responsibility of IAVI and do not necessarily reflect the views of PEPFAR, USAID, or the United States government.